Welcome, I'm Janak Goyal, and in this section I will review the scanning techniques of ankle and foot. The examination of ankle and foot is focused to the structures based on clinical impression. The systematic technique of ankle and foot examination is for learning and teaching purposes only. The ankle is examined from four quadrants: anterior, posterior, medial, and lateral, and the foot is examined from its dorsal and plantar aspects. The anterior aspect of the ankle can be examined with the patient supine, foot and ankle free for easy manipulation, or patient seated, knee flexed to 45 degrees with the foot resting on the examination table. Structures evaluated during the sonographic examination of anterior ankle include the tibio-talar joint and from medial to lateral tendons of tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. A mnemonic for the tendons from medial to lateral is Tom hates Dick. The anterior tibial artery and deep peroneal nerve are located between the extensor hallucis longus and extensor digitorum longus tendons. Let's start with the short axis scan of the anterior ankle. The transducer is placed at the ankle joint in a transverse orientation along the short axis of the tendons and neurovascular structures. Sweep your transducer up and down over the structures of anterior ankle and examine from medial to lateral the tendon of tibialis anterior, the tendon of extensor hallucis longus, anterior tibial artery, deep peroneal nerve, and the tendon of extensor digitorum longus. Toggle your transducer to differentiate between the tendons and hyperechoic fat by the use of anisotropy. Now place your transducer in the mid-sagittal plane to examine the anterior recess of the tibio-talar joint and shift your transducer medially and laterally to examine the parasagittal areas of the recess. For the examination of the medial ankle, the patient is placed supine with the knee flexed and hip externally rotated, the so-called frog leg position, and start your examination superior to the medial malleolus in a short axis plane. From anterior to posterior, examine the tendons of tibialis posterior, flexor digitorum longus, the posterior tibial vessels, tibial nerve, and flexor hallucis longus. A mnemonic for these tendons from anterior to posterior is Tom, Dick, very nervous, Harry. Now examine a very important relationship of these tendons to sustentaculum tali. The tibialis posterior tendon lies dorsal to sustentaculum tali, and the flexor digitorum longus tendon is immediately superficial, and the flexor hallucis longus tendon is located plantar to sustentaculum tali in a bony groove of calcaneus. Now to examine these tendons along the long axis plane, the transducer is turned by 90 degrees and these tendons are examined along their long axis starting from the posterior tibia and going up to the attachment of the posterior tibial tendon and examine the tendon of the flexor digitorum longus and flexor hallucis as they move deep into the plantar aspect of the foot. Let's now examine the lateral ligament at the medial aspect of the ankle. There are four different components of the deltoid ligament. The anterior and posterior tibio-talar components, tibio-navicular component, and the tibio-calcaneal component. For the examination of the deltoid ligament, the transducer is placed in a coronal plane at the medial malleolus and sustentaculum tali. Here your medial malleolus and the sustentaculum tali to assess the tibio-calcaneal component, of the deltoid ligament. Now rotate the distal end of the transducer anteriorly to assess the anterior tibio-talar, which is the deep component of your anterior part of the deltoid ligament, and the tibio-navicular component of the deltoid ligament. Here is the anterior tibio-talar and the tibio-navicular component of the deltoid ligament. Now rotate the distal end of the transducer posteriorly to examine the posterior tibio-talar component of the deltoid ligament. While on the medial side of the ankle, let's examine another important structure, the plantar calcaneonavicular or the spring ligament. The spring ligament is attached to the anterior margin of sustentaculum tali and the plantar aspect of the navicular. The ligament has a fibrocartilage facet on the upper surface for the articulation with the head of the talus. For the sonographic examination of the spring ligament, place the proximal end of your transducer at the sustentaculum tali, and the distal end of the transducer is placed on the plantar aspect of the tuberosity of navicular. Here is the anterior aspect of your sustentaculum tali and the plantar aspect of the tuberosity of navicular. The spring ligament supports the plantar aspect of the head of talus. For the examination of the lateral ankle, patient may be seated or supine with a slight inversion of the foot. The structures which can be examined on the lateral side of the ankle include the peroneal tendons, the peroneus brevis and peroneus longus, and the three components of the lateral collateral ligament, sinus tarsi, and the posterior subtalar joint. Start your examination of the lateral ankle just above the lateral malleolus in the supramalleolar region along the short axis plane, and identify the muscle belly and tendon of peroneus brevis and the tendon of peroneus longus. Remember, the peroneus longus tendon is superficial and posterior to peroneus tendon, which is a very important relationship to remember. Now examine the peroneus tendons along the long axis, starting at the supramalleolar region. Follow the peroneus brevis tendon to its attachment to the tuberosity at the base of fifth metatarsal bone, and also follow the peroneus longus tendon to the groove on the cuboid bone. Let's now examine the lateral ligament of the ankle. Lateral ligament has three components: the anterior and posterior talofibular component and the calcaneofibular component. Now place your transducer on the lateral malleolus, and the posterior part of the heel to examine the calcaneofibular component of the lateral ligament located deep to the peroneal tendons. Here are your peroneal tendons, and here is your calcaneofibular ligament, and here is the lateral malleolus and the posterior part of the lateral aspect of the heel. Now place your transducer on the anterior margin of the lateral malleolus and on the anterior aspect of the body of the talus to examine the fibular ligament. Here is your talus and here is your talus, and here is the lateral malleolus, and here is the anterior talofibular ligament. The posterior component of the lateral ligament, that is the posterior talofibular ligament, is not routinely examined. For the proper and complete examination of the posterior ankle, the patient is placed prone. The Achilles tendon is examined from its origin to its insertion to the calcaneus along its long axis and along its short axis. The retrocalcaneal bursa is located between the Achilles tendon and the posterior aspect of the calcaneus. The anterior aspect of the foot can be examined with the patient supine, foot free for easy manipulation, or patient seated, knee flexed to 45 degrees with the foot resting on the examination table. Examination of the foot is based on clinical presentation and should be done in both long axis and short axis planes. For the purpose of learning, examine all different joint cavities between the tarsal and metatarsal bones. Examine all MTP and IP joints, and also look for the Freiberg's disease in adolescent teenage girls with the foot pain. The Freiberg's disease is a collapse of the articular surface of the second metatarsal head, mainly in the teenage girls. Examine metatarsophalangeal joint along both long axis and short axis for evidence of joint effusion or any synovial pathology such as crystal deposits and erosions. The plantar aponeurosis is an extremely thick layer of deep fascia attached posteriorly to the medial process of the calcaneus. Anteriorly, it splits into 5 slips which are held together by some transverse fibers. Each slip is firmly bound to the proximal phalanx of the toe by plantar ligament and a fibroflexor sheath. For the long axis examination of the plantar aponeurosis, place the proximal end of your transducer on the medial side of the plantar surface of the heel and direct the distal end towards the middle of the plantar surface of the foot. Now rotate your transducer by 90 degrees and place it on the medial side of the heel to examine the plantar aponeurosis along its short axis. Examine the plantar aspect of MTP joint along both long and short axis for any subcutaneous pathology, and examine the flexor tendon and the plantar aspect of the MTP joint for any abnormalities.